Now, today in this video, I wanted to discuss about an interesting company called TissUse, which is a Berlin, Germany-based biotechnological company that also has developed a unique multi-organ chip platform that provides preclinical insight on the systemic level using human tissue. Now, before I get started, I wanted to do a quick shout out to one of my subscribers who actually told me about this company. A lot of the times when I do my research, I just go on Google and look for different types of hair loss treatments in the pipelines. I go to different forums and also Reddit to see all the hot stuff that pertains to hair loss and hair transplantation. And a lot of times, my viewers also send me comments and they give me different ideas and also tell me about these companies that I've never heard of. So I wanted to thank each and every one of you for just being able to collaborate with me and just by being able to provide information so that I can go ahead and share it with you guys. So TissUse's technology platform consists of a miniaturized construct that closely stimulates the activity of multiple human organs in their true physiological context. TissUse's multi-organ chips provide a completely new approach to predict, for example, toxicity, ADMA profiles, and efficacy in vitro, reducing and replacing laboratory animal testing and streamlining human clinical trials. TissUse is in the developmental stage of their smart hair transplants, also known as SHT. And because we know that hair transplants are limited when it comes to donor hair availability, TissUse has discovered a more effective, efficient, and less painful process. The way that their research is kind of based on is the fact that they isolate cells from the derma papilla or the root of the hair follicle, and TissUse claims that it is actually possible to go ahead and expand and culture those cells to form neopapilla. Now, it kind of sounds like Dr. Suji's research where they extract grafts and then they end up multiplying the stem cells. But neopapilla are the precursors of hair follicles, which have been shown to grow hair follicles under controlled conditions in vitro. Now, the approach is obviously extremely efficient compared to the standard, and it's going to require the cells from about 30 punch biopsies from the back of the donor zone, which can yield about 10,000 neopapilla. That's about 300-fold more than hair transplants. And in the case of smart hair transplants, the process is also going to be autologous, so clinical trials may not even be required or for a short duration if at most. Each of these neopapilla has the potential to form brand new hair follicles, and TissUse states that their proof of concept in clinical trials is the next value-adding milestone towards clinical application and commercial use. So obviously they're still in their infancy, but nevertheless, it is actually interesting to go ahead and read about another company that is working towards stem cell research to go ahead and regenerate hair. So their mechanism of action works by the following. Now, TissUse expects that the neopapilla to be able to induce hair growth through two separate mechanisms. The first one is to rejuvenate the dormant hair follicles through injection of the neopapilla at the site of the dormant hair follicle. So I'm not sure how effective this is going to be when it comes to, people who are already bald, because these would have to work for dormant hair follicles, and a lot of times the dormant hair follicles are on areas where people are thinning, but we just have to wait and see. Now, the second mechanism of action involves de novo creation of a hair follicle by recruiting keratinocytes and melanocytes from the surrounding tissue to the site of the injection. This is a process that is going to closely follow the organogenesis of the hair follicle, and which TissUse can also observe in vitro in their microfollicle model. If this twofold induction mechanism allows for a higher hair density, it obviously has to be proven in the clinical trials by comparing their smart hair transplants versus established methods of hair transplantation. We haven't heard from TissUse for a while, so I actually was doing some research and I found that there were some people who actually reached out to TissUse to get an update regarding their SHT technology. And they replied by the following by stating that they are actually in a very late preclinical developmental stage and they plan to move to a first clinical trial in the next years. Well, obviously, it's going to take some time. Like I said, they are still in their infancy, but they also did recently have an agreement with J. Hewitt in Japan, and it's going to be at least a couple years before SHT is going to be available as an alternative to conventional hair transplantation methods. Now, one of the main concerns that researchers have is when the derma papilla cells are cultivated in vitro for a prolonged period of time. What happens is they tend to undergo changes, and that's reflected in the loss of inductive hair growth capacities, TissUse previously stated that they can actually go ahead and overcome this by generating their so-called neopapilla using a special tissue culture technique where the neopapilla is very closely going to resemble the dermapapilla in vitro. Now, so far their in vitro micro follicle model shows many similarities in gene and protein expression to the native hair follicle when they were asked if the newly created follicles will end up mimicking the donor hair follicles. And TissUse also claims that the process of delivering these neopapillae to the scalp may consist of an automatic process performed by a device similar to a hair transplant. But we don't know at this stage since it's too early. But earlier this month, we actually had some pretty good news regarding TissUse, where they actually entered into an agreement with Japan's J. Hewitt, where they were granted the development and distribution rights to its existing smart hair transplant technology. Now, J. Hewitt is a biopharmaceutical company in Japan that is focused on creating transformative regenerative medicine for aesthetic surgery. And under the terms of the agreement, TissUse granted J. Hewitt an exclusive license in Japan for the development of novel cell-based hair regeneration therapies, leveraging TissUse's SHT technology and expertise. This is obviously very good news because we know that Japan has been very, proactive when it comes to promoting regenerative medicine due to its aging country. And as you know, we have Replicell's RCH01, which also has an agreement with Japan's Shiseido in licensing their hair regeneration technology. And the reason why these companies are targeting different types of partnerships, especially in Japan, is due to Japan's legislature support through the introduction of their new laws to go ahead and expedite otherwise lengthy clinical research and trial application processes to go ahead and promote competitive advantage in the international market, which also means faster commercialization of the product. Now, I think that it's a little too early to get excited about this company using dermapapilla cells to go ahead and regenerate hair follicles, since they haven't even completed a proof of concept yet. And like I said, it's going to take years and years to commercialize if they're successful. But the direction that the research is going is nevertheless interesting. As well as, other biopharma, companies who are actually looking into regeneration, stem cell multiplication for hair follicles. I still believe that Shiseido's RCH01 and their research based on their derma sheath cup cell extraction is most likely going to commercialize first sometime, I want to say around 2022 or 2023, once their derma injection RCI02 device is out in the market. I assume that Dr. Tsuji's stem cell research is going to follow after that. So while we wait on that, it's always good news to know that there are other companies who are currently in the works of looking for a cure or even better treatments, even if it's not a cure, to go ahead and treat androgenic alopecia. And the good thing that we have right now is that the field of stem cell research has really made giant leaps, I want to say in the last decade. So I feel that we are, in good hands, and more than likely, I feel that hair is probably going to be one of the first types of cells we are going to have the ability to create and implant into humans. We are still keeping our eyes on Dr. Tsuji and their human clinical trials, but we have no updates as of yet. And as soon as I hear back regarding Dr. Tsuji's research on humans, I will get back to you guys. But that's pretty much it. This company is interesting. If you guys are curious about exactly the different types of stuff that they're doing, I will leave a link for the company below in the description box. If you guys like this video, please give it a thumbs up, and I will talk to you guys next time. Take care.